My name is Sharon Peacock. I'm a professor of Microbiology and Public Health at the University of Cambridge in the United Kingdom. I'm just about to give a talk at the Global Leaders Group ESCMID combined meeting on diagnostics and AMR, and in particular looking at diagnostic innovation. There are many diagnostic needs, but the areas I will be highlighting will be that we need more innovation in the community where most antibiotics are actually consumed and prescribed in terms of point-of-care tests, but also strengthening the diagnostics infrastructure and ecosystems in hospitals so that we can use well-established tests to improve patient care, as well as network that information. I'm also passionate about innovating in relation to local manufacturing, and so we need to be manufacturing local tests in countries such as Africa, and so that they can develop their own affordable and high-quality tests. The meeting here today will really facilitate the goals of diagnostic innovation and development, because we'll be talking about the areas of need, and people in the audience, I very much hope, will be thinking about how they can innovate in the diagnostics AMR space in the coming years. The participants at this meeting are going to be from a very broad background, including people from industry, microbiologists, clinicians, policymakers. And so to get this group of people together listening about diagnostic innovation is going to be a very powerful mixture of people indeed. Diagnostic innovation is a team sport. It needs a wide range of people, ranging from patients and their doctors, right the way through to industry and policymakers to introduce those tests. And meetings like this are great conveners to bring those people together so that they can start those discussions.